The Healthcare Foundation and the Reach Foundation on the Kansas side were innovative uses of funds that were set aside from the sale of the Health Midwest hospital chain. This money has been used for a variety of nonprofit, health-related enterprises, both with government and with nonprofit NGO types of entities. But one of the great things about this endeavor was that it was a large enough block of money that the grants that are made on ongoing bases are large enough to make a significant impact for our community.
Since their founding, they've invested over $200 million in grants to the region. They focus on the access to health care and the quality of health care.
So the Healthcare Foundation was established to take care of the underserved and uninsured through leadership, advocacy, and resources. Those are the things that we dedicate to improving the health of the community and especially of those populations. We mostly fund in three primary areas: safety net, mental health, and healthy lifestyles. We actually have a portfolio of more than 200 active grants at this time, so really quite a broad range of activities that the Healthcare Foundation funds. And so those are our direct services, but we also work a lot on the advocacy side because it makes a very big difference in well-being if you can address things at the environmental level and not just at the individual level.
The Reach Foundation is a health philanthropy that was started about 10 years ago to address the healthcare access needs of people who are uninsured and underserved in a 6-county service area. We work on a multitude of projects, mostly related to healthcare access and quality, and we also have a very active public policy advocacy agenda and program as well. We also want to help people understand that our foundation is as much about improving the quality of life in this community as it is anything, and we know that it takes all of those things functioning together: education, government, health, business.
Both foundations focus on the underserved in our community. When all of us are healthy, physically and emotionally, we have a healthy community and we become desirable for people to come and live in our communities to work and play.
Well, we're blessed here in Kansas City having two healthcare foundations that both understand that health is a lot more than illness care. So these foundations also understand prevention. One in particular has been funding our violence prevention program that's responsible for having cut homicide rates in half in Sector 330 of our East Patrol.
Both the foundations, in my opinion, lead the way in innovation. So the Healthcare Foundation of Greater Kansas City funded the unified government for a sidewalk and trail master plan, which I think was almost unheard of for a health foundation to fund an infrastructure project.
One of the big initiatives that the Health Council took on this year was enrollment into the health insurance marketplace. And both Reach and the Healthcare Foundation supported the work of the Community Health Council in bringing together organizations from all across the county. It was the investment of the foundations to say, we know you're trying to figure it out, we want to support you, and we're here for you, not just financially, but we're here to support you in any way we can. And I would say because of their investment, we were able to do things that we'd never done before.
We partner with the Healthcare Foundation on many, many efforts, and I'm so thrilled that we've been able to maintain that partnership and positive relationship over the last 10 years. It's important because the needs are so paramount and so prevalent in our service area that we're better together and we work better and can address more needs if we're working collaboratively and collectively.
You know, Brenda and I have been friends for a long time. I used to work on the grantee side, so I actually was a grantee of the Reach Foundation a long time ago. And so it's lovely to have two women working in this area, and being able to work together has been a great privilege.
If people only knew the impact that these foundations are having on the lives of Kansas Cityans who may never know the name of Reach or never know the name of the Healthcare Foundation, but are living healthier, longer lives because of the investment that they're making in Kansas City.